everyone, my name is Arushi Gupta. I am a fourth year medical student and today we are going to talk about the difference between botulism and tetanus. So as you can see, botulism is associated with flaccid paralysis. Now this flaccid paralysis is caused because botulism toxin goes and attacks the acetylcholine neurotransmitter at the receptor junction. So you do not have any acetylcholine going from junction to junction. That means you are blocking the signals, and if you block the signal you get a flaccid paralysis. Now, what are the common causes for botulism? The common causes for botulism include consumption of raw honey in infants less than 1 year of age, because that raw honey might contain spores of this toxin as they can last for a long amount of time, or it can also be transmitted through wounds. Now, what are the classic symptoms for botulism? So the classic symptoms for botulism, as we said, includes flaccid paralysis, which is seen in a descending manner. It's also associated with cranial nerve palsies. For example, it's associated with diplopia, dysphagia, etc. But you do not have any sensory loss in botulism. One thing to keep in mind is if this toxin involves a diaphragm, it can cause respiratory suppression and the patient might need ventilatory support. What's the best treatment for botulism? It is to give the anti-venom for this condition, and that will make the patient feel better. And as I said, if there's involvement of the respiratory muscles, the patient might need ventilatory support. Moving ahead to tetanus. Tetanus is associated with spastic paralysis. As we all know, the most common way a person can get tetanus is through wounds from any rusted nails or any metal objects. Now, what is the most important prophylaxis which we need to know about tetanus is the Tdap shot, which usually patients get when they are young, and then a booster is given every 10 years. Now, why is there spastic paralysis seen in tetanus? So the tetanus toxin, it goes and it inhibits the inhibitory neurotransmitters. So as you can see, you have lost the inhibition. So you are having so much of excess firing that now you are having spasms. These spasms are usually ascending or generalized. Then the most common feature which is seen in tetanus apart from the spasms is lockjaw. Now, we need to understand that if the tetanus toxin involvement is severe enough, it can also affect the autonomic nervous system, and that's why what you need to do for the treatment of tetanus is to provide the patient with the tetanus immunoglobulin plus the tetanus shot and any other antibiotics if there is infection with the wounds and wound debridement as well. So it's important to differentiate between botulism and tetanus. How do we treat them and how the symptoms are different, as these are usually seen in the emergency department and need to be treated urgently. Thank you.
Observerships, doodles, CVs, interviews, we help you match stronger. Contact me at connect@drsinghmd.com.